We're going to go over some of the foundational anatomy, and we're going to go based on, I forgot the name of this pose, but let's just call this neutral. And first thing you guys want to do when you're trying to learn foundational anatomy and basic biomechanics is learn the joints first, and just learn the major joints. Just know the shoulder joint, elbow joint, hip joint, knee joint, and then ankle joint, right? So those joints, and then the next thing you need to know is the action at that joint. So at the shoulder joint, we have abduction, okay, which is kind of like when you're getting abducted. That's how I remember it. Abduction, when the arm goes away from the midline. If you have a line in the center of the body, abduction goes away from that line, could go all the way up to here. Adduction goes all the way back down. We have flexion at the shoulder. We have extension at the shoulder, goes backwards, flexion goes forwards. You also have horizontal abduction and adduction. And again, it's relative to the midline. And then we have internal rotation and external rotation. So these motions are happening regardless of what's happening at other joints. So even if my elbow is bent, this is still abduction, this is still adduction, right? We have internal rotation, goes this way. Doesn't matter if my arm is straight or my arm is bent, this is still internal rotation and this is external rotation. And then with the rotation, watch this, if I hold on to my arm, it's not just about the palm flipping over, because I could turn my palm over and I'm not really producing internal rotation. It's about the humerus, this upper bone here, internally rotating and externally rotating. So just a small detail. At the hip joint, we have, it basically mirrors the shoulder joint. So we have flexion of the hip, boom, extension of the hip. We have abduction, abduction of the hip, and then adduction back to the midline. We have internal rotation, which looks like this. We have external rotation, which looks like that. You have horizontal abduction away from the midline, and then horizontal adduction towards the midline. And now moving on to the elbow and knee. The elbows can go into flexion. This is very easy to remember because flexion is basically just bending, and then extension is just straightening. Same thing with the knee. We have flexion and extension. You can do combinations. You can have hip flexion and knee flexion, or you could have hip flexion and knee extension, right? You could have hip extension and knee flexion. You could have hip extension and knee extension. So those are the combinations. You can have shoulder abduction, elbow flexion, and then shoulder external rotation. So that's how you want to practice those motions. So first memorize the motions first memorize the joints. Shoulder joint, elbow joint, hip joint, knee joint. Memorize those basic joints, then memorize the motions. Shoulder and hip flexion, shoulder hip extension, abduction, adduction, external rotation, internal rotation. Okay, so they kind of mirror each other at the shoulder and the hip. So once you memorize those things, the next thing to memorize is the primary muscle that produces that action. So at the shoulder joint, shoulder abduction is done by the shoulder muscles or the deltoids. A lot of people like to say it's the mid delt, but technically all three fibers, the front, middle, and the rear delts, all fire to raise the arm into abduction. And then on the other side is the lats here, they pull the arm into adduction. So if you imagine these muscle fibers as like a bunch of ropes or like rubber bands shortening, right? We have the deltoid right here. If these bands shorten, it would lift the arm this way. The lats are kind of on the opposite side. If they shorten here, they pull the arm this way. So that's it for you visual guys. That's how you would imagine it. Chest. This is a chest fly. The chest does this. The fibers of the chest, a lot of them are horizontal. So they would pull the chest into a deduction. And then your traps and your rhomboids and your rear delts will work together to produce horizontal abduction away from the midline because they're pulling away. Shoulder flexion, which is done by the chest, but just for the sake of this video, the front delts are going to produce shoulder flexion because they're right here on the front. They would shorten. And then, as you could probably guess, the rear delts, when they shorten, they pull the arm into shoulder extension. Right? For internal and external rotation, don't worry about memorizing the names, but just know you have a couple muscles that rotate your arms inward and then a couple muscles that rotate them outward. And a lot of them are found on the shoulder blade. Right? So we have the internal rotator muscles and the external rotator muscles. All of them together make the rotator cuff. Right? Most of you guys should know this, right? What produces elbow flexion, which is elbow bending, is the bicep. Boom. And then generally speaking, on the opposite side would be the muscle that produces the opposite motion. So the triceps are on the back of the arm. They attach to the back of the elbow. When they contract, they would pull the arm into elbow extension. Right? And then at the hip, we have the group of muscles. You don't need to know individual names, but the group of muscles that work together to produce hip flexion are called hip flexors. So pretty easy to remember. Hip flexor muscles produce hip flexion. One of the muscles is one of your quad muscles. Okay, most of the three of the quad muscles cross the knee joint, but one of them also crosses the hip joint, and that produces hip flexion, and that's called the rectus femoris. Okay, so it's one of your quad muscles. All the quad muscles together produce knee extension. Okay, that's why when you sit on that machine, do knee extensions, or they're called quad extensions. That's why they work the quad. The back of the leg, the hamstrings produce knee flexion. And then the back of the hip, we have hip extension done by the glutes and the hamstrings. These two together both produce hip extension. What the hamstring does that the glute doesn't do is it does knee flexion. Okay, because the glutes only cross the hip joint, the hamstring crosses the hip and the knee joint. So down here, it goes knee flexion, boom. Glute medius, or your glute muscles, your glute medius that produce hip abduction, boom. They're here on the side. That's why when you do side leg raises, you feel that side butt. And they also produce hip external rotation. And then just, you don't need to know the individual names of these muscles, but the muscles on the inner thigh, the adductors, produce hip adduction and also internal rotation. Okay, you don't need to know the individual names, just know that they're here. You have your glute medius that are going to do this, and then like your inner thigh muscles that do that. So that's it. Review the major joints, memorize that, review the major actions at those joints. Lastly, review and remember the muscles that produce that action.